Trophy Mom podcast. So, as a first time mom, when I think about labor, the first thing on my mind is like pain, discomfort, life or death, which is not what I really want. Hiring a doula can be very helpful to make a positive childbirth experience. And in our studio today, we have Sarah from The Peaceful Birth. Hi, how are you?
Good, you?
Alhamdulillah, good. Thank you so much for being here. When I first found you, right, I actually scrolled through Instagram and I read your Instagram account at the Peaceful Birth. Wow, this is the kind of birth that I want. So that's why I contacted you and I really want to get to know more about doula services. So, do you mind to explain first what is doula and how did your journey as a doula begin?
Okay. So I only got to know of a doula for my second birth, and I wanted a home birth for my second one. And then when I didn't get the birth that I want, even though I had an unmedicated birth for that birth, it still wasn't what I wanted. So then I explored being a doula and I thought like, okay, maybe this is something that I want to do and like support other moms because for all my births, I felt very empowered and I felt that this is how moms should feel during birth, not like moms who feel very defeated or moms who feel like everything is done on them and they have no say. So I want them to feel like, wow, this is the hardest thing that I've done and I did it, you know? So I took on the journey to be a doula. I became a doula before I gave birth to my third one. And for my third one was the best birth experience I had. That's why I'm doing what I'm doing because I want more moms to feel how I feel.
Yeah, more empowered and having control for her own body, right?
Yes.
Yeah, that's exactly like what I really want, and I'm looking forward for my labor. Okay, so first thing first, we are going to play a game.
Okay.
So it's a true or false game. We have two flags for you here. So if it's true, you can raise the green one, and if
Okay.
it's a false, the red one, please.
All right.
All right.
Sure.
Okay. So true or false that the doula support is not necessary in hospital setting? False.
Very false.
Yeah.
In fact, I would say you need it more in a hospital setting because of all the interventions. And you and your husband might not know what is okay to reject and what is not. So then a doula would really help to guide you.
Yeah, and I think also during the contractions it can be like very long, can be very painful. Like when I talk to my friends that have been in labor. So yeah, I think doula is
Yeah.
very necessary.
If I can highlight one more thing, I feel like not many people know the pain intensity also is different depending on the position of your baby. So sometimes some moms feel more pain because of the position of the baby. And when you're in that position, you don't have a doula to guide you on how to manage it. Sometimes it can go, you can't control, it's harder to manage. And that's when you probably ask for an epidural.
Okay, the second one, true or false, a doula can take over a partner's role in providing emotional and physical support during labor.
Okay. False. So a doula does not take over the partner's role. What she does is she empowers both.
Right.
So I find that a lot of couples, especially Asian couples, the husbands don't really know how to support their wives. They are more of a passive supporter. So they're
Right.
just there and they wait to be told what to do.
Exactly.
Yes, right? Yeah, I mean, but
They don't know anything. It becomes so annoying for the wife,
Yeah.
especially when she's in pain.
correct. And you still have to manage somebody, right? Right. So when I'm there, what I usually do is I would prep the husband what he can do. So when the husband knows his role and he knows what to do, that would be even better because I find that husbands, when they know what they're supposed to do, they show up even better.
Right.
So yeah.
So that's why in most of your classes, it's for couple.
Yes.
So it's from the mom and the father,
Correct.
not only the
And
mom.
mostly for the father actually.
Right.
As when yeah. But I don't want to say.
Alright.
It's for the ego.
Yeah. Okay.
Alright.
True or false? Water birth reduce labor pain.
True.
True?
I would say, yeah. Because when you're in the water, you're relaxed. So then when you relax, the hormones that you need are all there. And then you don't feel as much pain. Yeah. But if you want to say that the water itself reduces pain, I would say no. I would say it's really how you feel when you're in water. That's
Right.
what is making you relax. Yeah.
Like the oxytocin rises
Yes,
and
yes. So
okay.
if you don't have access to water, I mean water bath or a tub, you can also do it in the shower.
Hmm.
Yeah, hydrotherapy. Yeah.
True or false? A doula can make medical decision for mothers during labor.
False. Yeah, we are not allowed to make any medical decisions. In fact, it doesn't have to be medical. Any kind of decision, it has to be from the mom and
Right.
dad. Yeah, yeah.
Okay.
But what we do is we will lay out all the pros and cons. Like for example, when a mom says that, okay, I want to take epidural, so then what I would do is I would say, okay, you're gonna take this. This is what you're gonna feel. This is the pros and cons. This is the side effects. So a lot of people are just focusing on the side effects of epidural, but they don't know that epidural actually lengthens the labor.
Yeah.
Epidural can affect the baby's going down the birth canal. The epidural can affect it goes through the placenta, so it makes the baby a little bit drowsier. So all this is not informed for them. So
Hmm.
then that's what I will do. And then if the mom says that okay, but I'm still gonna take epidural, then I said okay. But at least that is coming from an informed decision. Yeah, so she's
Right.
fully aware. Yeah.
Okay. So the decision is still up to the mom
Yeah.
and dad. True or false? Doulas often have conflict with obstetricians.
Mm, false, I would say.
Hmm.
That depends on the doula. For that one, it's really with how the doula is as a person. So
Hmm.
for me, I would try my best not to have conflicts because my priority is really the well-being of the mom. So if I'm there trying to argue with the OB, trying to argue with the nurse, it's not going to create a nice environment, a comfortable, safe environment for the mom.
Right.
She's going to be laboring, and when she hears the bickering and all that, it's not going to make her feel comforted. So that's the last thing that I would do.
Hmm.
If there are conflicts, what I would do is I would just tell the husband, okay, this is what you can do, and then this is what shouldn't be done. Maybe I will just give an advice, and then the husband will be the one doing
Hmm.
the work. So we
Okay.
have also had like nurses who are not very kind to the mom in labor. Like for example, the mom is managing the pain unmedicated, and then
Hmm.
the nurse just comes in and just there was one instance where the mother's water bag was open, so she was leaking a lot of fluids, and we were just calling the nurse to help clean her up. And then for some reason, I don't know why, she was a bit irritated,
Hmm.
so she was taking the tissues and she was just like wiping it very harshly,
Hmm.
and it was not a nice thing to feel. I mean, when you are in labor, right,
Of
somebody treating
course.
you that way.
Yeah.
Yeah, so then I was just like, giving an eye contact to the husband, and the husband said like, if you're gonna do it harshly like that, let me be the one to do it. And then like he called her out, and then after that she apologized. Yeah.
Right. I've heard some of that as well, and it's not a nice experience to have,
For sure.
especially when you are in the middle of a battle to give
Yeah.
birth to your child.
Yeah, you're in pain.
Yeah.
Somebody just treats you that way. It's just unacceptable. Yeah.
It's so bad.
Yeah.
Okay. So, is it true that in Singapore, not so many people or moms or dad knows about doula?
Yeah, I would say it's not well known yet.
Mm.
Yeah.
Like whereas in some countries like Canada, Indonesia even, like a doula is like a very important support during the contraction because contractions can take very long, right?
Yes. Like 18 hours, 24 hours. Yeah.
See.
Not scaring you.
I
You
know.
got this.
Yeah. But yeah, just gotta be prepared for
Yes.
it.
Yeah.
Okay. So the research shows that having a doula has positive impact on both mom and the baby's health outcomes and experience. What kind of support can a doula provide for pregnant mom?
Okay. So I can't speak on all doulas because other doulas do it differently. So what I do is I support them a lot during the pregnancy phase. When it comes to like their nutrition, if they have any questions about nutrition, their well-being, and then towards the end, towards the 37 weeks, I will have two prenatal consultations where we will go through the birth plan that she's gonna have. I will go through 4 birth plans. So I'm not just planning for one birth plan. We plan for four different outcomes in the event that if the birth doesn't go the way that she wants, then she is not left confused and lost. So she's
Mm.
also prepared even if it becomes an emergency cesarean. I also support the husband in knowing what he needs to know, what he needs to do, and everything. And then during the labor day, I support them emotionally, I support them physically, sometimes when they need help, and then mentally as well.
Mm.
And then after the birth, I support them postpartum. So I have two postnatal visits where I just come and just check on her well-being, because the hormonal jump is so different, like from you had the baby and then after that postpartum. So
Mm.
having someone there to check on you and not the baby, it would make a big difference lah.
It will be
Yeah.
so meaningful, I
Yeah.
suppose.
Yeah, I had one mama who texted me. She said, what really made me feel seen was when everybody was asking for the baby and you were the only one who said, "How are you feeling?"
Mm.
And it's just a normal question, and I do it for every client, but
Okay.
it was very impactful for her. And when I felt very touched and like, wow, my job is actually really important, even though it's not so.
It is
Yeah.
important. Like, what do you say? Because, okay, the first time I know that I am pregnant, the first thing on my mind is, okay, who is going to be my doula? From the experience of my friend in Indonesia or in some other countries, but not in Singapore, because in Singapore, not so many people are aware about doula.
Yeah.
But with a doula, their birth experience is so much more positive. So they said like it's really good, especially when your husband doesn't know what to do. Get a doula to get a support.
Yeah.
When is the best time for pregnant mom to be working with a doula? Like, how often should they meet for optimal support?
Okay. So I would say on second trimester.
Okay.
So that's the period usually that she's more energetic. She's not really drowning in morning sickness and all that. But even if a mama reaches out to me at first trimester, I will be more than happy to help. But usually at the second trimester, we can start talking about meeting the right gynae, I mean OB.
Mhm.
So having the right OB also matters. It's like you're inviting someone to support you on the day that is a life changing, that you're going through a life changing experience. So, for example, if you want an unmedicated vaginal birth and you have an OB who's not supportive of that, or who's not exactly supportive of that, then you might have the OB sabotaging your birth. You
Mm.
understand what I'm saying?
Yeah.
Like if you want it undisturbed and then you have that OB and you're just like, okay, I just take this OB because everybody recommends me, and then on that day, you are completely fine. You are completely okay with managing the birth, but the OB feels like I have to save her from this contraction pain. I have to get this baby out quickly when there's no emergency. So then your OB might actually sabotage your birth because of that, because of her anxiousness. So I've seen that happen. So that's why I always highlight the importance of finding the right OB. Make sure you are on the same page. So we
Mm.
can do that from the second trimester. And then, yeah, that's when we can start working together. Yeah.
You're right. So choosing the right OB is very
Correct.
important.
In fact, everything like the right doula, the right OB, the right confinement nanny,
Mm.
the right massage therapist, the right confinement meals if you're having confinement nannies as well. If you are working with, for example, if you're the kind that you want to breastfeed the baby, and the
Mm.
confinement nanny that you have is used to taking the baby away from you and sleeping with the baby. So
It's not gonna
you're gonna
happen.
create,
Yeah.
yeah, you're gonna create conflict.
Mm.
So some moms like that. Some moms want to rest after birth. Take the baby away from me. So,
Like,
but
let
some,
me heal.
yes, correct. So these kind of things, you really have to make sure that all these people that you are inviting to support you are on the same page as you.
Okay.
Yeah.
So it's important to get like the right support, especially for the first year, like the closest support
Yes,
system.
correct.
Okay. So we talked about birth plan before, right?
Yeah.
Like you will help the mothers to make birth plans. And you mentioned just now that you are making plan for vaginal birth. What if it's a cesarean? What if it's a emergency
Yes.
C-section? So you are a doula that is not a pro for a vaginal birth, is it?
Mm. So if I can put it in words, what I do is I'm a doula that is pro what the mama wants. Yeah. But because of my content and whatever I put out there, usually I attract people who want an unmedicated vaginal birth.
Hmm.
Yeah. So but what I find that people always make the mistake of planning for just one birth plan. So then if they don't get it exactly to that, they would have birth trauma, they would have birth disappointment. And
Mm.
then when I realized that, okay, that is actually, you're actually setting yourself up for failure if you're just focusing on one. But if you focus on, okay, what's going to happen if I don't get an unmedicated vaginal birth? So what's going to happen if I get an epidural? What's going to happen if I'm induced?
Hmm.
Because you can say now I'm not going to get induced, but maybe when you're 41 weeks and baby's still not here, you might consider the possibility of getting
Getting induced,
induction,
yeah.
right? Yeah. So we plan for all this. So then if you actually have to go through it, you are well prepared. Yeah.
Right.
Yeah.
Okay, so that's me because I was just planning for okay, my birth plan is gonna be like this rainbow and unicorn
Yeah.
things.
Right.
All right, that's a good thing to know.
And also, I don't just plan for what to do during the birth. I plan on how she wants to be supported.
Hmm.
So I also ask, okay, if you want to go through this, how do you want your husband to support you? So different people have different characters. Some people like being touched during labor, some people don't. So I always say, are you the kind that is very touchy? What's your love language? I ask them and all that. Then they always say that, okay, sometimes for some moms, they will say, I don't want the husband in the room. I want to just labor on my own, just on my own, husband outside with my older kid. Some moms say, okay, I want to be massaged, I want to be touched. So that's just a guideline to guide the father, the husband, to know what he needs to do. But on that day, if she feels like, okay, I want my husband to support, then he knows. So it's not like, so when the husbands go through the birth plan, also he knows, okay, this is what I have to do. I'm not
Hmm.
just there during the birth, I must be there during the labor as well. Yeah.
Right.
So really how she wants to be supported.
Yeah, that's important because I'm
Right?
the kind of person who is so touchy. Like I want my husband to massage me. I want him to be there
Yeah.
to give me the oxytocin that I need during that phase. I only want my husband for now. We don't know yet, but let's see.
Yeah.
For low risk pregnancy, like do you support home birth?
Like I said, I support whatever the mama wants to do.
Right.
Yeah.
But you have you ever managed to help home birth before?
Yeah, an accidental one. So I had one.
There is.
Yes.
Okay.
So I had one birth. There was one birth. We were laboring at home because she wanted an unmedicated vaginal birth. So we were trying to labor at home as long as possible to
Hmm.
prevent
Intervention.
interventions in the hospital, and she was fine. Um, but we were laboring, and then when it was time to go to the hospital, I was telling her, okay, it's time to go to the hospital. But then suddenly she was like, okay, I need to push. And then when I looked down, I saw that the head was coming out. And in that moment, I said, okay, if you go to the car or go to the lift, you're going to give birth there. So it doesn't make sense to go now. You should just get the baby at home because home is still even a
The
secure, a
safe.
safe
Yeah.
place. You have all the towels and all that. So then we said, okay, just stay at home, get the baby out first. And then after that, they made their way to the hospital. So it wasn't planned, but I would say it was very well managed.
Right.
Yeah.
So it's the destiny. Okay. So as a pregnant mom getting closer to labor, what should she be preparing for?
I would say she has to be prepared for going through labor the way that she wants to, and just be prepared to relax.
Hmm.
So I've met a lot of moms who are, high functioning adults who always want to do things. And if they don't do anything, they feel like, okay, I'm not productive, right? They always want to do something. But the beauty of labor sometimes is it helps you to slow down. So maybe you can relate because you have your own business and you're always doing something. But when it comes to labor, sometimes you have to slow down and you have to surrender at some point. Like surrender, this is like I've done my part, I've put in my effort, now I surrender and um to what Allah wants to
Yeah.
have.
Leave it to God.
Yes,
Hmm.
leave it to God. Yeah. So what I always see is moms don't know how to relax, don't know how to slow down. So then when it comes to labor, when the labor is long, they don't know, they get impatient with themselves. Why is it taking so long? And then that's when they go to the hospital and get an epidural just to, because they're done with the labor. But then that's your expectation that
Mm.
you have to do it fast. But labor is meant to be slow and long, and just unpeeling all the layers that you're turning into a mother, right? You're going
Right.
through, it's a rite of passage. So you're becoming someone that is new. So it takes a while. It's gradual. It's not fast.
What makes a contraction takes very long. Like sometimes it can take up to 36 hours. Isn't that too long according to you?
Okay. So it depends really on the lifestyle of the mother, the body of the mom,
Mm.
and how she actually feels during the labor. When you hear stories of labor being long, sometimes when you go down and say what you ask the person, how is it, how was your labor actually, you can sometimes, what I notice is when the labor is really long, it's usually when the mother don't feel safe. So the body does not feel safe to do what it needs to do.
Hmm.
So for moms who are induced day to day, one after another, they don't progress, they don't dilate, it's because the body just is not ready, or it's not feel does not feel safe to give birth. But also sometimes the positioning of the baby is something that you also learn. Like the baby, when it rotates, it has to rotate to a certain angle to go down the pelvis. So then when the baby takes time to rotate, that is also what's going to take a while.
Right.
Yeah, and then sometimes also depending on the body of the mom, if the mom has a few issues or the body is a bit misaligned, so then it's not optimal.
Mhm.
That's why the labor is taking a little bit longer.
Is it true like a stress level can make it longer
Yes,
also?
for sure. So it's the same concept of not feeling safe. When the mom is stressed, it's not oxytocin that's being produced. It's adrenaline, it's
Cortisol.
cortisol. Yes. So she's stressed, she's not she cannot give birth because she's stressed. Yeah, that's why there's a delay in the labor. I always tell my moms that I work with, her only job on that day is to relax and get through each contraction.
Have to
Everything else the husband has to take care of, like the hospital bag, the administration, and everything else.
listen,
Yeah.
husbands. Share this one with your husband.
Yeah.
It's your hard work now, okay?
Correct.
I attended a hypnobirthing class. Actually, it makes us practice of breathing techniques and positive affirmations. Do you think positive affirmations for mother is important?
For sure, yes. If anything, I would say that when it comes to birth, it's not really your pain tolerance, it's your mindset. So positive affirmations, when you keep telling yourself for weeks, when you start from like 30 weeks onwards, you keep telling yourself that you are made to give birth. Your body can give birth. Your baby will come when he or she is ready. When you keep telling yourself that, it becomes something that you believe in,
Hmm.
and on that day you know you can do it, so you'll do it. For me, what I would say is harder to work with is when the mama herself is not confident to have an unmedicated. So if she wants an unmedicated vaginal birth, but if she's not confident, that is harder for me to work with, because first I have to manage that first,
Hmm.
her work with her, and then we'll get what she wants. But if I have a mama who's super confident and she says, I want an unmedicated vaginal birth, literally I would just support her with how it goes. And she's so confident, I don't even have to do anything much.
Hmm.
But if she's like, I want an unmedicated vaginal birth, but she's like, what if my doctor says this? What if my doctor, very doubtful, very anxious, that is, I have to do another layer of work
Oh.
before. Yeah.
I'm afraid I'm overconfident
Oh,
for some of this.
I don't think so.
Okay. So unmedicated vaginal birth is really what I want. And actually, if I can share my birth plan with you briefly, what I want is also skin to skin immediately with the baby for 1 hour
Yeah.
minimum, and also a delayed cord clamping
Yeah.
for like 15 minutes. Is it possible to be done in Singapore? Are there hospitals who support that?
Okay, so in Singapore, skin to skin, definitely yes, because most hospitals practice that
Mhm.
right after the baby comes out. They'll put, unless there's anything that is emergency.
Emergency.
When it comes to delayed cord clamping, so for hospitals like KKH, they would say maximum 6 minutes. Six
Hmm.
minutes. For I can't remember Thompson, but NUH is also 6 minutes, but also it depends on the care provider that you're with. So I also have doctors from these hospitals who say that, okay, let's just wait until the cord stops pulsating. So, even better. That's why I say you
Hmm.
have to get to know the gynae, the OB that you're working with, and then ask these questions. How long would you let me wait for the
Cord
cord to
clamping.
stop pulsating? And then if they say as long as you want, then that's even better. You have to have all these discussions, because if you don't, then they're gonna do what is routine for them. That means when baby comes out, if you don't make it clear, they're just gonna clamp immediately. and that might be something that is disappointing for you.
Yeah.
Yeah.
So those are the kind of questions that you should ask the OB
Yes.
before deciding who to give birth with, right?
Yes. Yes.
Okay. How do doulas support pain relief during labor, and like what are common techniques used to help with discomfort?
Okay. So a lot of people think that doulas are always doing during the labor, but what we must also remember is that labor should be undisturbed. So if the mama has found a coping mechanism, whatever that is, like maybe in the water or in the shower or with a comb, like a birth comb, if you've heard of it,
Hmm.
and she's fine, what I would do is I would just, my presence is the support. So I would just be at the side. I would just look at her. I would just monitor her. I would just offer her food and drink, and that's it. Because if she's doing fine and I'm like, okay, come, let me massage you, let me change your position, that is also a form of intervention. Don't you agree?
Hmm.
Right? So I would leave her alone. But if she looks like she needs more support, maybe the pain is even more at that moment, what I would do is I would suggest her to change position. I would suggest a massage either from me or the husband to do like a double hip squeeze at the back.
Hmm.
I would give the birth comb or the stents machine that we can also use. I would also suggest that she remain upright or different positions, depending on how she is. So if she's like, I want to lie down during the labor, I just cannot be on my back. I just cannot be upright. But if I'm there saying that, oh no, you have to be on your back, that's also clash, right? She's
Hmm.
not going to be feeling comfortable. So I usually will just assess the situation, see what she needs, and then I support her with that.
Right.
Yeah.
Support what the mom needs
Needs.
at that point
Yeah.
of time. Right.
Yeah.
If like a mother decide to do a C-section, is a doula support necessary as well?
Very necessary, I would say.
Really?
And I'm not just like saying this because I'm a doula, but I've seen moms going through cesarean, and the first thing in my head is like, what would, I mean, how would you go through this without any support? Your husband is clueless,
Mm.
you're clueless what to expect, and just nobody there to guide you. So for my the moms that I've worked with, if they have to go through an emergency cesarean, what I would do in the chaos of everything, I would just prep her, just go to her ear with she would see all these nurses and the OB just trying to scramble and get everything quickly done.
Hmm.
Nobody's gonna come to her and say, okay, this is what you're gonna do, because that is my job. So what I would do is I would hold her hand, I would whisper in her ear, I would say, okay, this is what you're gonna go through. We've talked about this, we've discussed this, I've prepped you. This is what you are going to go through right now, and how are you feeling about it? So I would invite her to feel, let out
Mm.
everything that she's feeling. She can cry, she would probably feel birth disappointment, but at least this time it's not as bad because she knows she has tried her best,
Mm.
and then this is the takdir lah, right?
Yeah.
So then I would prep her, and then after that, when she's good, I would ask the husband and wife to just spend like maybe 5 minutes together before she's being wheeled into the operating theater. So to just, I'm here for you. I'll be outside the door. You got this. You're the strongest woman I know. Affirmation.
Affirmations again.
Yes. So when you say, yeah, it's so, so powerful. It makes a lot of difference. Imagine you're having that, and then imagine in a different scenario when you don't have a doula and your husband is like, very confused where to go, and the OB just say, okay, you go outside. And then the wife is just like, okay, what's gonna happen? I don't know how long this process is gonna take.
Hmm.
What's gonna happen? Where will the baby go? Who's gonna cut the cord and everything? It's a lot to digest on your own. So then
I think it's gonna make the cortisol level even.
for sure. Yeah. And I've had a lot of, so I don't just work with first time moms. I also work with second time moms who had birth trauma from the first one.
Hmm.
Yeah. So the first one, they had an emergency cesarean and they were very lost. They had a lot of feelings about it. So when I work with second time moms, it's always, almost always a lot of tears, a lot of emotions being pent up. Like they had disappointment that the husband wasn't there, and then husband was also feeling like, in fact, actually, husbands, they feel so much um disappointment in themselves for not being there to see the baby being born.
Hmm.
I had one client who was very sure that he couldn't go in during the emergency cesarean, but then for this next birth, I asked him to ask the OB, and the OB said, "Yeah, you can go in. Why not?" So then he felt like, "Wow, why didn't I know that for the first birth? I could have gone in,
Right.
right?" So these are information that when you don't know your rights, then you actually don't have any rights, right?
Yeah, you have no control over the situation anymore.
Yes.
So yeah, it's
Yeah.
becoming a not so positive birth experience.
Yeah.
That's so
So
bad.
sad. Yeah.
Yeah, and we cannot repeat that moment again, right?
Yes. So then it just keeps bugging you
It
for a
is
while. Yeah.
for life, I think.
Yeah.
So, from your experience as a doula, what are the triggers of baby blues and how they can be supported through it?
From my experience and even from my personal experience, I would say what triggers baby blues and postpartum depression is really the lack of support.
Mm.
Yeah. So whenever I talk to a pregnant woman, the first thing I would say like, how is your postpartum gonna be? That was what I asked you also because that is support is really, really, really important during the postpartum period. And if you don't have the support, that's when it's all gonna just spiral and that's why you go down to postpartum blues, postpartum depression. You might have problems breastfeeding with the you can have problems with the breastfeeding, you can have problems with the incision after cesarean,
Mm.
you can have problems with your husband, because you are more snappy during postpartum, you can have problems with the baby like diaper rash and all that, but throughout if you have the support you are not going to have it as bad as when you don't have it and then you have the problems. So yeah, I would say the most important thing if you can invest in your postpartum is to find the right support.
Is it
Yeah.
true that water burst can minimize perineum tear?
Yes, yes. I didn't tear.
You didn't tear.
I want to show you my birth video. My baby slipped out
Uh-huh.
and I didn't realize that the baby was out. So I was just like laboring in the water, but because the contractions were so intense, it was back to back.
Mm.
So at first it's gonna be like every 10 minutes, every 8 minutes, and then it's gonna be 5 minutes. Sometimes when you are not when you don't feel safe, then you don't have the contractions and then it comes again. So it's not always that gradual and uniform. And then once you are birthing the baby, the contractions are gonna be back to back. So that's why I was just focusing on the contractions. Then I realized that, then I saw her, she was out. So my uterus literally pushed. Have you heard of the fetal ejection reflex? That was what I felt. The baby just came out. I didn't push and I didn't tear. Yeah.
That's the thing that I want. Like I want like in Indonesia there's such thing as like tiup tiup keluar. So
Yes.
that kind of breathing techniques, if I can say, the breathing techniques where the mother doesn't have to push like like that.
You don't have to do that.
You don't have to do that, right?
But in hospital, you might have to. So again, depending on what they're used to doing, they are used to coaching the mom how to push. So it's hard when you have a certain vision and you want it undisturbed. You wanna just yup like that. But then you are in a place where you don't belong, where they tell you how to push, where they will do this and that. So
It's a wrong place.
it's wrong place, exactly. So you really have to see the place that you're birthing with if it's aligned with what you want. I find that Indonesia is very big on this also. Like in Bali, there's Ibu Robin who's very big on this, and that's why like actually she influenced a lot of people also in Singapore because of her.
How can I minimize the tear, the perineum tear? Is it
So
possible?
yeah, so it's a lot of things that you can do. Drink water, 3 liters per day. This will help with your skin elasticity. Because if you're dehydrated, your body's making a lot or using a lot of water to make the blood, to make the amniotic fluid. If you're not drinking enough, your skin, when you have when you have your skin elasticity is better, so that when it stretches, it's so much better. You will not tear.
Yeah.
That's the first thing. Another thing is so nutrition really, really helps. And then some people do perineum massage.
Okay.
Yeah, you can just Google that. There's a lot of videos that you can do. And
The husband massage
yes,
it, right?
I mean, yeah, because you're pregnant and
You cannot
quite
drink.
hard. Yeah. So husband will have to do it. And then also the technique when baby's coming out, when you have to breathe a certain way and blow, you do hypnobirthing, they would
Yeah.
teach you, right?
Yeah.
So then that would really, really minimize. Definitely, if they're telling you how to push, if they're coaching you, say, okay, 1, 2, 3, hold your breath, push. That is definitely gonna create some form of tear for sure.
Okay, last question. What kind of support that a husband or a partner should do during the labor?
So I would say the husband has to be an active supporter and not a passive supporter. And the difference is, as an active supporter, you are always there and you are always doing the things that the mama needs during that time. For example, nourishing her with the food, giving her emotional support, and then making sure she drinks, and then when she needs to go to the toilet and all that, you are always there, but not to the point that you are too intervening. But if you're a passive supporter, you are just there with your phone and you are waiting for your wife telling you what to do, then I would say that's not really a good support, because she will not feel comfortable and she will not focus on the contractions because she will always have to think about you.
Right.
Yep. So that's not a good support. So for the husbands listening to this, if you think that, okay, I'm just gonna wait and let her tell me what to do, please don't do that. You have to be an even better supporter. You have to be an active supporter.
Right.
Yeah. And in order to do that, in order to know what you can do, is to watch more birth videos, and then you see what the daddy do. Especially, I always recommend watching home birth videos, not because you are planning for a home birth, but because you see the role, what the mother does and what the mama does and what the daddy does. So then because you've seen it, then you would know what to do on that day itself. Yeah.
Right.
Yeah. So it's really great.
Okay, so educate yourself, daddies, and it's really good if you can get a doula to support you with this all.
Yeah. Sometimes also I tell the father a lot to do what he needs to do. Like I would say, and then sometimes when the baby's out, out of happiness, they would just focus on the baby. Then I would just give them a nudge and say, kiss your wife's forehead because
Yeah.
she just gave birth.
Hmm.
Then he would be like, oh, okay, then I need to focus on the mom for a bit because
They need to be
Yeah.
reminded for these
Yes.
small things. That's the
Yeah.
thing, right?
Yeah. So that's my role.
Yes. That's super important, guys. Like, thank you so much for listening to this podcast, and thank you so much for being here once again.
Thank you for the invite.
Thank you. Bye.
Bye.